I'm Peter Block for On the Scene here in Chicago at the AHA annual meeting. And with me is Ron Lacrow from the Children's Hospital in Boston, one of my old stamping grounds. Ron has just published in the New England Journal and is reporting on here at the AHA. Interesting study, Marfan's in kids, how to minimize aortic root dilation. So Ron, tell me about your study.
So we randomized 600 patients between the age of 6 months and 25 years, all with Marfan syndrome and aortic dilation. And half of them got treated with losartan and the other half got treated with atenolol.
Okay, so this is randomized. Now, why did you choose losartan? ACE inhibitors in the past have made some difference. Did you think this would be better?
Well, beta blockers are really the mainstay for treatment, and we know that the hemodynamic effects of beta blockers are beneficial to people with Marfan syndrome. But recent studies have shown that losartan might be better. There are mouse model data and small human studies that suggest that losartan might be better than beta blockers.
Okay, so the might be is the question. So what did it turn out to be?
So our studies show that there was really no significant difference in the treatment effect between the two drugs. We expected that losartan might be better, but there was no significant difference.
Now, Ron, you measured aortic root diameter by echo. It was randomized, so obviously that couldn't be the culprit as to why there was no difference. What about subgroup analyses? Anything to indicate some signal?
Well, although there was no difference between the two groups, it seems like the younger kids responded to each of the drugs better than the older kids. So there is an age effect that we found, and that was true for both drugs.
And that's in terms of the endpoint of root dilation, or just when you say responded to, what does that really mean?
Right, so the change in aortic root Z-score, which is a measure of severity of the aortic root dilation, the decrease in aortic root Z-score was greater in the younger patients compared to the older patients for both drugs.
Do you think there's a next step? Are you going to look around some more, or what are you going to do with this?
Well, there's some important dosing issues. We don't really have good data as to what the optimal dose for losartan is. It's possible that a higher dose of losartan might give a better effect. We use high doses of beta blockers in this study, higher than most other studies, and that suggests that you really need to titrate the beta blocker dose to hemodynamic effect. Okay,
so there you have it. Marfan's beta blockade is still, I guess, the primary thing that we should worry about and make sure our patients are on it. Losartan, maybe not so much, but maybe some questions still out there, right, Ron?
Right.
Thank you.